Hi, my name is David Emerson. I'm a long-term cancer survivor and director of People Beating Cancer. Welcome to the vlog post entitled, How Much Does Cancer Treatment Really Cost? Remember, there will be two separate blog posts. What does cancer treatment really cost? What does cancer treatment cost after insurance? Two separate issues. This vlog post and the attached blog post below is what does cancer treatment really cost? So, it's in your best interest to understand basics. A good example would be chemotherapy regimens, which can be quite expensive these days. What your treatment plan will, the chemotherapy regimen monthly, annually. If you, in my cancer's case, there's a whole lot of chemotherapy in the induction phase, but it's common, your cancer may or may not be the same as this, but it's common to go into remission for a time, 1, 2, for some people, a long-term remission, 5 years, and then come out of remission and get more chemotherapy. Understanding the cost of those chemotherapy regimens is important. It's beneficial to you going forward managing the general term is financial toxicity. So understand your cancer, your type, your stage, so you can understand what treatment really costs. 5 basic jobs to do immediately when you are diagnosed with cancer, in my humble opinion. Job 1, review your insurance coverage, figure out what your insurance policy or Medicare pays for and what it doesn't pay for. Job 2, begin prehabilitation now. Getting in shape for cancer care is important. Studies show that your body will do better if you exercise, even if it's only for a few weeks before you begin treatment, even if you're only walking briskly around the block every morning. Sleep, nutrition, try not to eat junk food, try not to drink any alcohol, do your best. Basically, getting in shape for active cancer treatment. Your body will like you for it. Your cancer treatment will cost less if your body manages toxicity better, fewer side effects, those kinds of things. Job 4, keep track of all expenses and all paperwork. Any grants that you apply for, anything that you do, understanding what you have paid for, the money going out, the money coming in. It's like managing a small business. You will benefit the better you keep track of all of the expenses, not just the big stuff like chemo and procedures, surgery, cutting out the tumor, but the little stuff. What does it cost to park every time you go see your oncologist? If you drive to a different city to see someone, staying overnight, meals, keeping track of all of that is in your best interest. Job 5, talk to human resources if you still work. Figure out what your company policy, what they'll cover, what they won't, time away from work, all of it. Figure out what you can do with your insurance policy, work, Medicare, all of it. It's in your best interest. As I said earlier, the blog post for this is linked below. Feel free to click through. If you have questions, comments, click through. You can ask me a question, post me a question. I'll reply to it ASAP. In the meantime, thank you for listening and hang in there.